Okay, now we're going to talk about therapeutic and surgical procedures. And the first is intramuscular injections, including immunizations. If you look on page 579 in your book, figure 24-15, it shows how to appropriately administer an ion injection to an infant. The needle is usually a 25 gauge, 5/8 inch needle. You can't put more than 0.5 milliliters of any solution in the muscle. That would be the maximum. And the vastus lateralis is the muscle of choice for infants. So to administer this, you stabilize the leg, clean the skin, insert the needle at 90 degrees, and then slowly administer the medicine. It's important that you do comfort measures that we talked about earlier. If you look on page 579 in your book, there's a little medication guide that discusses the hepatitis B vaccine. And then on page 580 discusses the hepatitis B immune globulin. So you want to be familiar with those. Now we're going to talk about circumcision. Circumcision is the removal of all or part of the foreskin of the penis. The American Academy of Pediatrics came out with a statement within the last couple years that stated the health benefits of a circumcision outweigh the risk of the procedure. So AAP is very supportive of circumcisions. However, it is a parental decision. Parents make this decision based on hygiene, religion, traditions, culture, and their social norms. It is a surgical procedure, so it does require informed consent. Prior to the procedure, some hospital policies require that you withhold the previous feeding, and that would be just like NPO for any type of surgery to prevent aspiration. Infants are placed on a plastic restraint, and then the penis is cleaned. So usually the cleaning and the prepping of the surgical site, that's usually done by the provider. And if you look on page 581 in your book, figure 24-16 has a picture of an infant that is in the plastic restraint, but you can see that the nurse has the infant wrapped up. The infant has a pacifier that's probably been dipped in sucrose, and then she's doing what's called facilitated tucking, and you can see one of her gloved hands is on the infant's head, and the other is on the infant's chest, and that's to help comfort the infant. There are 3 different devices that can be used for circumcision. The most common probably is the Gomco clamp, is what you've seen in the hospital, but this is totally based on provider preference and how they were trained. But the Gomco and the Mogen clamp, those surgically remove the foreskin and they minimize blood loss. Also, after those two, whether you use a Gomco or Mogen clamp, part of the post-op care is to put a Vaseline gauze on the tip of the penis, and then Vaseline petroleum at the tip of the penis until it heals, and that's to prevent the penis from adhering to the diapers, because that can be painful. The other device is called a Plastibell, and this is positioned over the glands, and then a suture is tied, and then extra skin is cut away, and the plastic rim falls off in approximately a week. And one of the big differences here for post-op care is no petroleum jelly, nothing Vaseline is needed, because the tip of the penis is not as exposed and does not adhere to the diaper. So here you can see in A that an infant is positioned, and B, this is a picture of a Gomco clamp. One of the things here you can see in A and B that here's the Plastibell, And kind of want to, not just a pet peeve of mine, but in general, we undertreat pain in newborns because they are crying, they can't talk back. People used to think babies couldn't feel pain, especially preterm babies. We know that is all not true, but circumcision is a very painful procedure and babies need to receive pain management. So there are 4 different types of procedural pain management. That includes a ring block, a dorsal penile nerve block, topical anesthetic such as Inlacrine, and concentrated oral sucrose. After circumcision, infants can be fussy, they can go into a deep sleep, and they can have disorganized feeding, and that would be normal after a circumcision. On page 582 in your book, it has care of the circumcised newborn at home. So this is, what we want to teach our parents, but you want to, after they go home, as far as the nursing care, you assess for bleeding about every 15 to 30 minutes for an hour, and then hourly for the next 4 to 6 hours. You want to monitor for urinary output. If the circumcision site does happen to start bleeding, you can apply pressure. It's very painful for the baby, but you have to stop the bleeding. Parents need encouragement on how to take care of circumcision because parents are a little bit reluctant and scared to take care of a newborn anyway, but especially circumcision. And it's normal, you want to teach them it's normal for the baby to cry when their diaper is changed. It hurts and it's uncomfortable. It's a surgical procedure. Next, we're just going to talk about neonatal pain. As far as the behavioral responses, the most common sign of neonatal pain is crying. If you look on box 24-4 on page 583, it shows acute pain in the neonate. You'll see changes in the heart rate, changes in the blood pressure, an increase in intracranial pressure, vagal tone, changes in the respiratory rate, and also changes in their O2 sats. So it affects basically every body system. As far as assessment of neonatal pain, there are several pain scales out there, and these are the most common ones: the NIPS scale, the PIP scale, the NPAS, and then the CRIES scale. If you look on page 584 in table 24-5, that has the CRIES scale. It's used in the NICU. What we know is healthy newborns are exposed to fewer sources of pain than preterm infants, and that's just, it's kind of sad. NICU babies, there are studies that have been done that go over the average number of painful procedures that babies go through when they're in the NICU. They have all their routine lab draws, IVs, all the different monitors. Being in the NICU is painful. So healthy babies actually have fewer interventions than the sick NICU babies. There are 2 goals of neonatal pain management. The first goal is to minimize the intensity, duration, and physiologic cost of the pain. And second is to maximize the infant's ability to cope with the pain and recover from the pain. So as nurses, we want to do everything we can to make it as least painful as possible, but also help the infant cope with the pain and recover from the pain. Management of neonatal pain. We have non-pharmacologic and pharmacologic management. So for the non-pharmacologic, I feel like as nurses, we are, this is definitely our responsibility. Containment or swaddling is where you wrap the baby snugly in a blanket with their arms extended, their legs flexed, and their hips in a neutral position without rotation. So you can swaddle a baby too tight, And so you just want to make sure that there's room for them to breathe and that their arms are extended, their legs are flexed, and their hips are in a neutral position without rotation. Non-nutritive sucking is when you can dip a pacifier in sucrose for painful procedures. So sucking is comforting to an infant after painful procedures. If a baby is breastfeeding, it's also very therapeutic for the infant to be placed to the breast and placed skin to skin. Even if it's not breastfeeding, placing the infant skin to skin is also a form of non-pharmacologic management. Facilitating tucking is when caregivers use their hand to swaddle, and there's a swaddling technique. And the perfect example was that nurse that was helping position the baby for circumcision. Pharmacologic management. There are local and topical anesthesia, and this is common to be used during circumcision and chest tube placement. Non-opioid analgesia includes acetaminophen, and these are often given for inflammatory conditions. And then opioid analgesia include morphine and fentanyl are the most commonly used drugs. Just know in the newborn nursery that really, aside from circumcision, there's not much for pain management, but the NICU and neonatologists do a much better of managing pain than the pediatricians in newborn nursery. For instance, your book talks about how babies could receive PO, acetaminophen, or Tylenol after circumcision for pain management, but I have never seen that in a nursery. Okay, now we're going to get closer to talking about discharge. So, promoting parent-infant interactions. There's a table on page 587 in your book. That helps parents recognize, interpret, and respond to newborn behaviors.